actually something that I'm interested in. It's something that I've felt like I think for like a long time should be. I mean, you know, should be legalized and especially available for patients for medicinal usage. And so then but it was never kind of this thing where I felt like I could delve into it just because it wasn't really, accepted. And so then when it became legal, I like asked when I was working at Kaiser, like, oh, is this something that I can delve into? And they were like, no. And I was like, okay. And so then when I left and kind of was like, oh, I'm on my own. I can kind of do whatever I wanted now. So then I was like, I'm going to spend the money. And so I did got the certification to be able to do it. And so then they have like a course that you have to take
okay. Yeah.
for Maryland. And so I did that. And then like I actually signed up. I'm actually doing another course, which is more extensive to kind of learn about the endocannabid, I can never say the word, system.
Endocannabinoid.
Yeah, thank you. See, can't even say the word. The system and learn more about it because it is something that really interests me because I think it's in some so yeah, that's just me.
We haven't quite started yet. We're just yeah, I think so.
Yeah. What did Kelly, for you, Kharia just cut out for a minute, or is it my internet? I've had some issues this morning. I don't know.
She's still there. It might have just for a split second.
Okay.
Oh,
no,
well,
yeah.
Let me know if I do cut out or anything because I live out in the backwoods.
No, I think it's my end. I had some issues with FaceTime even this morning. A patient.
Oh, really? Ooh.
Yeah. Kelly, did you get your hair cut?
So I got it cut. There'll be 2 weeks tomorrow. So yes, but then I took the scissors to it again a little bit.
So you went out and got your hair cut?
So my person is a solo person and she has her own space. Mm-hmm. So it's very like well controlled, single person, wipe down in between. I had to sign a waiver saying I didn't have all those symptoms and everything. Mm-hmm. She used to do hand massages. Obviously she doesn't do that anymore, like when you have your conditioner and everything. But so yeah, I was lucky.
Wow, that's awesome. Yeah. That's awesome.
One of my friends went to like the Aveda hair school. So she's I don't know what the certification she has is, but I haven't gotten my hair cut since February. So I asked her if she could come over and do a masked patio cutting.
Yeah.
So she's gonna do that because I'm like,
awesome.
I'm afraid to go into a salon, but
yeah,
this can't wait another like 4 months. Anyway, so all our patients can hear this lovely conversation.
Yeah, exactly.
But you know what? What? Go ahead.
I was going to ask, is it possible, like after this meeting, can I do like a quick FaceTime with you for a personal reason?
Sure. Okay. Let me look at my schedule. Yeah, should be good. If not, I have a little opening. Like I have a 1 o'clock patient, and then I have a little opening after that. So if it's not, it depends on when we finish.
I just need like 5 minutes at the max.
Okay.
Really quick. You're probably going to laugh and say I'm crazy.
Doubt that.
Now I can't wait. All right, so it is noon. Dr. Cowen, I think you're going to draw a big crowd because I think you have such a big panel of patients that I think we're going to get a bunch of people who miss your face who are going to. I don't know who your patients are, but I bet if you scan through our attendees, you probably know a disproportionate number of them.
All right, good to know.
I need to ask Travis, I have a PowerPoint that I'm trying to pull up. Hold on. I'm trying to get rid of like other stuff that people don't need to see. Will I have that ability?
Yeah, I already made you a presenter.
Oh, you did? Okay, so now I got to figure that part out. Okay.
So down in the middle, there should be 1, 2, 3, 4, 5, 6, 7, maybe 8 buttons. The third button says share content.
Okay. Okay.
So
cool. Oh, no. That gives them all my notes. I don't want to see my notes.
Just then,
I think
once
that's
you
just the
look it
next
up-
slide.
Yeah.
But does it show my notes?
Yeah.
Yeah.
So you want to go up to use slideshow
Ah,
and click that, and it should. There you go.
okay. I knew you were. You're so smart.
All right. Well, let's get started while we're waiting for people to sign in. For those of you guys who have been following, I am Dr. Tanno, and I am moderating the webinars we've been doing. So while Dr. Holmes and Dr. Cowen are just pulling up last minute things, just announcements, there is no webinar this Friday. Sorry about that. And then on Monday, we have a webinar from one of our clinical psychologists, Dr. Stephanie Park. She's going to talk about coping with stress, anger, and helplessness in this era of the racism pandemic. So a little bit of COVID, a little bit of what's going on with the race riots, and basically dealing with some of the emotions around that. So that should be a good talk. We've done a few talks with our clinical psychologists, and I think usually people find them very helpful and give me good feedback after. So I expect this to be the same. And then next Wednesday is a talk from another outside doctor. Dr. Mahmood is a hematologist, oncologist from the same group who's been coming from Maryland Oncology, Hematology, and he's going to be talking about anemia. So that should be interesting as well. And then next Friday we are off because it is the 4th of July weekend. Crazy that has already come. And then we'll have to go from there. I think we might be actually winding webinars because we have some things in the works for the office to reopen. So stay tuned for changes after that. So I think we might really taper down to a different schedule. So without further ado, Dr. Kharia Holmes is one of our new doctors. She joined our practice in February, and Dr. Kelly Cowen has been here 20 years, 15 years, long time.
17 and a half.
Right in the middle. Okay. And they're going to be talking about medical marijuana. Dr. Holmes has an interest and has done the training for it. You don't prescribe right now, right, Dr. Holmes? You just have done the training to pursue prescriptions.
Oh, no, I do prescribe. I just haven't had any patients.
Oh, okay. So both of these sorry about that, guys. Both of these doctors, Dr. Cowen and Dr. Holmes, are licensed to give out to do consultations with patients and do medical marijuana prescriptions and consultation and management. So they're going to talk today. Dr. Cowen has been doing these on a small scale at our office for the last maybe year. And Dr. Holmes came from Kaiser, so she'll have to tell us about her experience with this. But I will let them have the floor, and then please submit your questions. I think those are always the most interesting part of the talk at the end, so that we can go ahead and get started. So, all right, guys, I'll disappear and I'll let you guys go ahead.
Hello. So it's wonderful to be here. Dr. Holmes here, and of course, Dr. Cowen. And so I just wanted to talk about medicinal marijuana or medicinal cannabis, just because it is something that I've recently added to my repertoire. And I kind of wanted to talk about instances where it can be helpful for patients, certain conditions, and just kind of have that conversation. I will say I am not the guru or the czar of medicinal cannabis. It's something I am learning about and taking continuing courses for, but it is something that I am passionate about, just because I think it can help some patients, and I've seen it help certain patients with certain illnesses. So I guess that's it. We'll get started. Is that okay, Dr. Cowen?
Sounds good to me.
Awesome. Oh, I muted myself, so I need to share my screen. I did it before. I can do it again, I think. Okay. Alrighty, so of course it's for medicinal purposes only. We're going to be talking about medicinal cannabis. So some of the things that I want to cover is basically what is cannabis or marijuana, as it's more commonly known. What conditions can medicinal cannabis be used for? I want to talk about some of the contraindications or relative contraindications that I believe, exist for patients looking at if it might be a good fit for them. Are there any medications that can interact with cannabis? So I want to kind of start talking about that as well. And then how do you apply for the medical marijuana card for those patients that are interested, kind of what the process is, and who in practice certifies patients for medicinal cannabis will be posted there. And then any questions that you guys may have. So starting off, trying to pull up two screens. So what is cannabis? So cannabis is basically a plant. It's an actual annual plant that flowers yearly. And there are two different categories, per my understanding, two different types. And then beneath those is like a myriad of intercross breeding and different blends and are the sativa and indica. So sativa is most commonly known as hemp. So this is basically where you're going to get your cannabidiol, which is not a psychoactive compound. So this is not the THC portion that most people kind of associate with marijuana. This is kind of the cannabidiol, which is more associated with energy, and anti-inflammatory properties and things like that. Hemp, so the plant itself has been used to make rope, it's been used for clothing, it's been used for paper and a myriad of other things. I like that word today. I think that's an SAT word that I'm working on, myriad. Indica, which is the other one. Now this one is the most commonly known as marijuana. This one is the one that tends to be richer in the THC compound tetrahydrocannabinol. I cannot say these words while I say THC, which is considered the more psychoactive component of cannabis that is typically associated with the euphoria, the highs, and all of that portion. So that kind of breaks it down into really just base level. And like I said, while there are definitely these two popular categories, there are definitely different blends and with different amounts of the cannabinoids and the terpenoids, which is another compound associated with the indica. So there's different blends and different concentrations and different oils and terpenes and all these different subcompounds in medicinal marijuana and in marijuana just in general and cannabis in general. So going on to my next slide. And I can't look at questions and do the slides at the same time. So I just want people to know I'll get questions at the end. Okay. So possible health conditions that can be helped by cannabis. So it can help insomnia. It can help what I call cachexia, or basically poor appetite. It can be helpful in children even who have had refractory epilepsy is where it's been used in children. Appetite loss, while you can have a what's considered a cannabis hyperalimentation, basically kind of recurrent vomiting from overuse or excessive use. Cannabis actually can be helpful for refractory nausea because there's a lot of different inputs and different factors that kind of go into developing nausea, particularly for patients who have cancer or gastroparesis. So it can be helpful for that. It is helpful for patients who sometimes have PTSD and some other mental health issues. It can be helpful for multiple sclerosis, muscle spasms, chronic pain. So there's a lot of different health conditions that can be helped, not necessarily treated or cured, but some of the words I'm looking for. Some of the symptoms of certain underlying diseases can be modified and made a bit more palatable with the use of cannabis. So Now to conditions to consider for cannabis use and cautions. I personally, and I think Dr. Cowen definitely agrees with me, we get very leery in using medicinal cannabis in patients that are under the age of 25. I have, again, never prescribed it at this point, or I shouldn't say prescribed it because I don't really prescribe. What I do is certify that you're able to go to a dispensary to get medicinal cannabis. But I think as a whole, looking at it in children under the age of 25, you have to definitely be concerned about their brain is still developing. And so kind of what the implications are that are going on with using cannabis for certain issues in the developing brain. So that's why, you really have to kind of look at the patient. Before COVID, the biggest issue that we were having prior to COVID was this interstitial lung disease that was really putting people in the hospital on ventilators prior to COVID that we really couldn't get a handle on. And before COVID happened, it seemed that the information that was coming out was a lot of the vaping usage was coming from using vaping cannabis, and some of the ingredients that were associated were causing lung issues for patients. So I'm very cautious in recommending vaping of cannabis, and I really try not to recommend vaping of cannabis for any of my patients just because the research and data isn't fully out yet to kind of determine exactly what was causing those lung issues for patients. And then medication, particularly Coumadin, was the one that jumped out to mind when I made this slide with the help of Dr. Cowen. So she did actually do some stuff, but Coumadin can cause an elevation in your cannabis can cause an elevation in your Coumadin level. So that is something that you definitely want to talk to your primary care provider about, and drug interactions of polypharmacy just in general. But going into a longer list and looking at medications and things to be concerned about, warfarin, as I said before, it can cause, cannabis can cause an elevated warfarin level. Theophylline, so patients that are on theophylline for various issues, it can actually lower your level of theophylline. So that's definitely something you want to make sure you talk with your primary care provider about. Benzodiazepines, did I spell that right? Cyclosporin, antiretrovirals. Basically, I just make a blanket statement. If you're on any kind of medication and it's something that you're interested in, talk with your primary care provider about it first, to have them go over the medications. I know Dr. Cowen also goes over medication lists, which is why we really try to keep this within Rockville Internal Medicine Group, because we have a complete history of all the medications that you're on, so we can look and make sure that we can counsel you appropriately as far as any possible interactions that may occur. Do want to say, in looking at medicinal cannabis use, do not recommend it in women who are lactating and women who are pregnant as well. That is definitely a contraindication that I've failed to mention on the previous slide, just because THC can be excreted in breast milk, and there's no data that really says that it is safe in pregnancy. So that is definitely something that I would recommend if you're thinking about becoming pregnant and you're also thinking about using medicinal cannabis for a whatever health issue that you might have, to really think twice in timing those two things. I would recommend not engaging in medicinal cannabis probably about 3 months prior to even thinking about conceiving, if at all possible. So how do you start the process? So as I stated before, I don't prescribe medicinal marijuana. I don't write a prescription, say this is how much you need and things like that. I'm hoping to get to that point. That's why I'm doing extra training that will hopefully allow me to feel more comfortable in being able to do that. But at this point, basically, I look and kind of over your health issues, and we have a discussion about whether or not this is a good fit for you. So the first thing that you'll want to do is you'll want to register on the website, and it's actually an MMCC at maryland.gov, and you can find where you actually want to register as a person who's interested. The second thing that you want to do is you want to reach out to a registered provider to obtain a valid certification. So I want to say that you want to do your part first in registering, before you see the provider, because if you see us first, there's nothing that we can do as far as getting you registered. So you want to register first, and after you register, then have a consultation with a provider to determine whether or not it's a good match.
Maybe I would add in that it's not the end of the world if somebody hasn't applied for their card yet through the state. If they simply want to, have a discussion as to whether this is something to even pursue. It's just that we can't certify you until you have registered with the state. So if you're okay with a little bit of a delay after the consultation, that's fine. So it's not a deal breaker if you haven't registered. It just makes the process more smooth if you already have your ID card by the time, or at least your ID number by the time you see us. But either way is okay.
Yeah. And then after we take care of that, we will do the valid certification and basically register you and verify you in the system. And then you'll be able to take that information with you to a dispensary, where then you'll be able to ask questions and talk with them about what might be a good fit and about the different compounds. Anything you want to add, Dr. Cowen? Because you're so awesome.
Nope, I think we're good.
Okay. So the services are offered at Rockville Internal Medicine Group, and it is self-pay. It is not covered by insurance at this time. So the initial evaluation is usually about 30 to 45 minutes, probably bank on about 45 minutes with Dr. Holmes, just because I'm slow. And that's it. And I talk too much. So the cost is about $150. And then subsequent evaluation is usually a much faster visit, about 15 to 20. And that cost is about $75. And I believe that subsequent visit is yearly, if I'm not mistaken, Dr.
Yes. Mm-hmm.
Yeah, is yearly. Right. And so that's pretty much it. And then Dr. Cowen's lovely, beautiful face. Look at that. That right there. I had to find that picture. She wouldn't give me a picture. And then myself. And so now I'm going to turn it over to any questions. And I'm going to stop sharing.
Yeah, we do have some questions. So we don't have too many. So if you guys have questions, please submit them. So somebody asked, keep the slides up, actually.
Okay.
One has a health condition other than the 13 listed in the relevant slide. Can one get a medical cannabis prescription? Medicinal.
Absolutely, yeah. I mean, these are a smattering of some of the diagnoses that are used. I would say that probably 95% of the certifications that I've done have been for some sort of chronic pain with a variety of sources of that pain. Some for insomnia, general mood, that kind of thing. But no, it is not limited to these because we have a little bit of leeway there, but this is a jumping off point.
Yeah.
Okay. And then
put every diagnosis known to man on the side.
Actually, do you know anything? I'm just curious about. I'm looking at that slide, and with the Alzheimer's disease, do you know what specifically the cannabis? What symptoms?
So there is a little bit, and it's not been well vetted, of research in that it can supposedly kind of slow the memory progression. But the other things that it's been seen to help with Alzheimer's disease tends to factor more on the mental health issues, as far as the depression and the anxiety that can be associated with Alzheimer's disease. So that's why I put that one there. Yeah.
Okay. I would add into that I could see it helping with appetite, maybe sleep, and again, maybe calming, an anxious person with dementia. That being said, the other side of it is anything that is psychoactive, you want to be very cautious about using anything with people with dementia type processes because it could exacerbate things. So none of these are slam dunks. It's absolutely on an individual basis. There is some experimentation that may need to happen. When you go and get a product, it might be a product that is, especially if it's for something pain related, it might be much higher in the CBD portion of it than the THC portion of it. Because the CBD is the non-psychoactive component, whereas the THC could potentially do that. So you just need to be cautious in some of the conditions that may alter your mental status. And I guess that kind of even ties into the medicines of any medicine that you're on that potentially could be sedating, could be potentiated by medical cannabis. And so these are all considerations to be made.
Mhm.
Okay. So here's a patient. I have chronic knee pain. Would this help in place of traditional medicines like diclofenac or Aleve?
It can. I probably would consider maybe like doing like a CBD oil prior to considering medicinal cannabis, like systemically, as well as, physical therapy, exercising, and all of the conservative things. But it can be helpful, yes. But it just depends on, it's, Dr. Cowen says it really does depend on the patient, which is kind of why we have that in-person consultation, because it really does depend on how you react to things, to determine if it's really going to be helpful.
Yeah, I mean, I would look at it as I would look at it as an adjunct to other things. I think it's rarely going to replace all the medicines that have been prescribed or the therapies. The knee pain is a good example of if people come to me with that and they have not done physical therapy or gotten a steroid injection or seen one of the rheumatologists or something. In addition to maybe considering the cannabis products, I would absolutely encourage people to pursue those other quote unquote mainstream processes just because they're known to be helpful. So, some people come and say, I have tried everything and I've done everything and this is kind of a last hope, and that's fine. But at the very minimum, it should be considered as an adjunct to everything else that you're doing, and very unlikely to be the be all end all of treatment of pain or something like that. This also leads in nicely to the different kinds of products that you can have. You mentioned the vaping product. Dr. Holmes mentioned the vaping products, which we generally discourage, but there are topical medical cannabis products. I usually recommend the tincture oils that can be put underneath your tongue, so very easily ingested and taken. I've had people with pills, little tablet pills. There are also, Maryland doesn't really have edibles like cookies or brownies or anything like that, but they do have little gummies, and sometimes people find it easy to take those. So with someone with a knee pain, perhaps it's a combination of a couple of drops and maybe the topical as well, in addition to the diclofenac. Or perhaps what it does is it allows you to use less diclofenac for your knee because you are also using something else. But it is not to the exclusion of your physical therapy and exercise and cortisone shots and Synvisc and things like that. And it's not going to keep you from needing a knee replacement, most likely, if if that's where you are. But, maybe worth a consideration.
Yeah, actually just thinking, I have a patient with rheumatoid arthritis, and she uses it she uses a topical on her hands and it helps. But okay, so here's a question. So we have some mental health questions, I guess. So what benefit does cannabis have for people with mental health issues such as anxiety and mood disorders? And then sort of a follow-up package question to that, what mental health diagnoses does the individual need to qualify?
Okay. So as far as, can you repeat the first question? Because I'm trying to.
I know it's a lot. So what benefit does it have for people with mental health issues such as anxiety and mood disorders?
So I have had some patients. So when I was at Kaiser, when I really got interested in this, but they would not allow me to prescribe, so I didn't pursue it. I had some patients that I actually referred out. And I had some patients that basically had issues. We had them on medications really to get their depression and anxiety under control. And I really felt like I had everything kind of teed up, but there were still these issues of sleep, some sluggishness and things like that. And so what I found was that when they went in and they, got their medicinal marijuana, that was kind of like the light switch for them. And again, I say this very cautiously because it really is patient dependent. But those patients were able to kind of fine tune without having to go on benzodiazepines or clonazepam or Xanax or things like that. They were able to stay on their fluoxetine or their general anxiety or general depression medication, and then use the medicinal cannabis as an adjunct for their situational instances where their situations would spike. And so they found it very helpful. I had another patient that I took care of who used to hate flying, and I would give her benzodiazepines, and then she would feel so loopy that she wouldn't even be able to drive herself to the hotel. Like, you know, she would always have to have a friend come pick her up and things like that. So she tried I didn't give her a card, and nobody gave her. She got something from someone. I cannot support this, but she tried it, and you know that's why she came to me, was because she's like, this worked. She was like, I was good for the flight. It was a long flight. I was good for the flight, and then when I was done, I felt okay. I felt okay enough to be able to get my own bag and be able to get my own car and be able to drive myself, you know, to the, you know, her friend's house, you know. And I was like, well, I can't help you, so you know I had to refer her out. So she found that helpful. And so for patients with post-traumatic stress disorder, it's definitely helped with their ability to, you know, sometimes the not the visions, but the nightmares kind of come, and it's been helpful there. So it's been helpful with anxiety, it's been helpful with depression, not so helpful with like schizophrenia or bipolar. I've heard, like doing some of the research and reading about the literature, that it's been somewhat helpful for some binge eating episodes. Kind of doing more reading on that.
Yeah, I saw a question that said, would it be a good alternative to antidepressants? And I don't think I would ever call it an alternative unless somebody had really tried 4 or 5 different medicines and not tolerated any of them, maybe in that circumstance. But I agree that it would kind of be the icing on the cake to other more tried and true and validated prescription medicines for those kinds of things. I think it's rare that we can't find a pharmaceutical medicine that doesn't help with those kinds of things, and so it would be in addition to something. I would rarely call it an alternative. Oh, but to answer the question about what kinds of diagnoses would meet the criteria, you know, it's up to our discretion. If you know, if it's anxiety, insomnia, mood, I mean, all those things will be able to play into it. And as long as we find that it may play a role, I don't think the diagnosis is as much of a trip up. More just finding the right product and having the right expectations for it, that this is just part of a bigger picture. It's not the only thing that we're going to do for a condition.
Right.
And then I have a question. There's a patient here who would ask, I'm just gonna, this patient should probably talk to their primary care doctor. The question is, oh gosh, I lost it in my feed here. Oh, I've been trying to use medical marijuana for anxiety and insomnia. Everything they have offered me either increases the anxiety or the insomnia, or makes me high, which I do not want. What do you suggest? So I think that's the kind of question it might be useful to just make an appointment, because it would be helpful to know what you've tried and specifically. So since we do have like 25 questions submitted, let me move on. Is there any consensus of opinion about prescribing medical marijuana or not across the practice? Is there any resistance?
I haven't met any resistance that I'm aware of. Most of the patients, I think, have spoken to their primary care physician about it, who then said, hey, come and see Dr. Cowen and talk about it. So I don't believe so. Obviously, our pulmonologists are not going to tell you to vape anything. So that would be one resistance. Again, the age issue of under 25, I'm very cautious about that. You know, with anything we do, we have to just make sure that the benefits exceed the risks. But no, to my knowledge, I'm not, well, maybe I wouldn't know if anybody is resistant to it, but I have not come across anyone who's particularly resistant to it that I'm aware of.
Yeah.
And I will say that when I started, it was something that I asked our office manager to kind of touch base with the practice partners to see if it was something that would be like accepted. And there didn't seem like there was any pushback at all. I mean, even though we have like a practitioner that's already doing it, they're like, yeah, if it's something you want to do, yeah. So I really don't think that there's, and some of the colleagues, I mean, I've talked to some colleagues about it, and I haven't had any of the colleagues that have talked about it, you know, say anything like, and I think we have a good enough rapport that if they had a problem, they would, be like, well, I don't really agree with that. Like, because we've had, tough discussions about other things such as PPE and all that kind of stuff.
Yeah, I think in general we have a pretty liberal practice, so I think we're sort of open to new ideas and things that can help patients.
Yeah.
Here's a question: can you discuss sleep medications, trazodone or Xanax versus cannabis? I'm concerned about addiction. What would you prefer, and what is safer? This could be a whole on its own, but maybe try to briefly answer that question.
This could be. So let's see, where do I start? Well, of course, everybody wonders about the Ambien lunestotide medicines, and there are drawbacks to those. I think when it first came out, I was quite comfortable with them, and I still am comfortable, but have to realize that there are downsides to them in terms of risk of fall, cognitive status, does it contribute to dementia in the long run? And there seems to be some evidence that it might. That being said, just because the other medicines like trazodone or Remeron or some of those don't say that, it doesn't mean that that's not the case. They just haven't been studied. In terms of the quality of sleep, I can say that the benefit of the Ambien and lunestotide medicines is that they don't alter the normal sleep architecture. Things like alcohol, Benadryl, and Xanax or Valium type medicines can alter your normal sleep architecture. So you may sleep a period of time, but it may not be quality sleep. And then to bring it around to medical cannabis, to be honest with you, I'm not sure what the data is on sleep or if there is data on sleep. So if someone came to me and said that they can't sleep, I would certainly talk about all the different options and what may be the best way to go, whether it includes cannabis or not. There are always going to be downsides to any medicine that is sedating, I think. I think we have to remember that it's going to have risks to it. And again, it's all just about evaluating the risk versus the benefits for every individual.
So the stuff that I've been reading in regards to cannabis and medicinal cannabis and use for sleep, it's something that, is more intermittent. Versus something long term. For some patients, it seems like some of the research or the literature that I've read seems to show that it might lose a little bit of effectiveness if it's something that you're trying to use long term to address insomnia. So I think using it as an adjunct versus, again, using it as your end all be all is probably a thought. Yeah.
I think we can hear your keyboard a little bit. So here's an interesting question, and I'm
trying to see where is this question.
Do you guys prescribe medical marijuana to anyone in recovery with from substance use disorder?
I have not yet. It has not been brought up to me. I would certainly not call myself well versed in that kind of thing. If someone were working with maybe a psychiatrist or a pain management person or someone who was managing that a little bit, and they asked me to kind of become involved in that, I would be willing to do that. But I wouldn't feel comfortable managing it all by myself with just the medical cannabis.
Okay. And then this is maybe more of the legal side. Has anyone ever run into any issues or backlash for obtaining a card if they work for the federal government?
Ooh, I've been asked that a couple of times. And yeah, so technically it's legal in Maryland, but it is not legal nationally. So definitely I've had people who've had concerns about their security clearance, their background checks, and that's a valid concern. And I think I would refer everyone to their HR managers to ask about that. I have had school employees talk to their HR folks about it, and they have been okay with that. So my guidance would be to talk to your HR person about how that would be looked at, because I think that is a risk if you work for the federal government.
Okay, and then this is a related follow-up question. If I register with the state, will it affect my CDL that I use for my part-time retirement job? So if you do any kind of, industrial truck driving, or you have your commercial license.
Yeah, I would say probably the same thing. I think you need to talk to your employer or HR or someone who can answer that question, because it may be that if they do random drug tests, how do they manage that if you come out positive, if it's prescribed? Now, I don't know, maybe the analogy is that somebody is on a chronic pain medicine for back pain and they know it's going to be in the urine and that's acceptable. So yeah, talk with your employer.
Yeah. Another question here. My issue is muscle tightness. Even a short walk can cause my neck and hip muscles to tighten. Stretching helps, but often nothing except Advil will release the muscles, which can cause severe headaches from the tense muscles. Would the cannabis help in this kind of a case?
Possibly. Yeah, I would say it could be worth a consideration. Yeah.
I think so, but I think I think what you're saying is this is another option. It's not like
yes.
So you might try something like a diclofenac topical, or might try some other things before you go to this, unless
right.
It's so far been very difficult to manage.
Yeah.
Okay, so there's lots of questions. So I need to start choosing. Okay.
Actually, while you're looking at the questions, one thing that I wanted to point out was someone had asked, are we experts in the blends and all this? So our only purpose is to certify that you have a reasonable diagnosis to pursue medical cannabis. We do not tell you what to get. When you go to the dispensary, you can get basically anything you want. We can give you suggestions, but you can get anything you want. If you wanted a consultation that got down into the nitty gritty of the terpenes and all the minute particles of the plant, there is a doctor over in Tacoma Park, and I put it in the chat. I hope you guys can see it. Dr. Patricia Fry, who does do that. And she has been doing this for years. She is an MD. It's Tacoma Park Integrative Care, I believe. And she will give you a recipe prescription to take to a dispensary and say, go get this. So if that was something that you were interested in, I would highly recommend her. She's amazing.
Yeah, I actually just referred a patient over this morning because the patient had tried a couple of different CBD oils that she had gotten and wasn't sure which brand to buy. And she said like the last one she got, the bottle was $190. And so I said, here's this doctor. I know that she's been doing this now probably like 20 years. And she has probably come across this question. So it's worth the consultation fee just to save you from running through all of that. Cause she came and gave us a lecture last year. She's done research and she's definitely a good resource as well as Dr. Cowen and Dr. Holmes. Okay, so what pricing and what does insurance cover, if any cost? I don't think anything, right? Okay.
I will say it's not necessarily cheap. It is not covered by insurance. It might even be all cash, if I'm not mistaken. You may not be able to use a credit card. If you can, I could be wrong about that, but it's not cheap and people can spend a lot of money trying to figure out what product is best. I will say, I guess that one of the benefits of getting it from a Maryland dispensary is that it's very accountable. It's been validated. You absolutely know the source of it. You know exactly what is in the product that you're getting. When you get an over-the-counter CBD oil, while it may be a very reliable source, we have no way of proving that. And so, even if you did just get a CBD oil from a Maryland dispensary, you know exactly what is in it and where it came from, and also what's not in it. It won't have anything in it that shouldn't be in it. So that's helpful.
Yeah. Okay. So, oh my gosh, okay. Sorry guys. I'm not usually this like spacey with these questions, but, so I think a lot of people are putting, follow-ups. So we talked about the CDL and the licensing. Okay. If someone is in federally supported housing, can they receive medical cannabis without risking their housing?
Federally, say it again, federally supported.
If someone is in federally supporting housing, can they receive medical cannabis?
Fabulous question. I don't know. There's lots of things running through my head of, well, how would they know? It's a prescription, but then if it's federal housing, if that was an exclusion criteria that you signed on to, you might want to ask, start with a landlord or something, or to whomever you pay the checks maybe, because I don't know the answer to that. Kharia, do you have any insight on that? Yeah.
I think when in doubt, if the outcome could be you losing your housing or losing your license or losing your job, when in doubt, you want to probably ask before pursuing medical marijuana. All right, so there are different types of vaping. There's the pen that you can buy, which that I think is what is dangerous. And then there's some machines that you can vape. What is the danger? And then the follow-up was, are the vaping machines safer than smoking? Lots of vaping questions. I don't know. What do you guys say?
Dr. Holm, you want to jump on that one?
No.
I think,
Well, I guess the way I would answer that is, regardless of the mechanism, you're inhaling something down into your lungs, and it's not ambient air, and there are chemicals in it, or there's an oil in it or something. And so I think it will have the potential to do damage. I don't think we know everything about it. Is it safer than smoking it? Possibly. I mean, I guess when you're smoking like a cigarette or something, it's not filtered. So is there other stuff going into it? But if I'm not mistaken, vaping is usually an oil, and oil does not mix with lung tissues well. So I think I'd be hard pressed to ever say that there's an absolute benefit of vaping that would outweigh the risks of it. Except if you have tried a lot of, I think I have a handful of patients who've tried other products and they just haven't worked as well. And so I guess that's up to you, but I'd be hard pressed to ever say that any sort of inhalant is going to not potentially have damage, identified down the road.
So now that the senior has spoken, I'm going to finally say what I think. I truly am against vaping it. It is something that I'm very passionate about. Like, as much as I'm passionate about medicinal cannabis, I am very passionate against vaping just because of chemistry background that I have, and then coupled with that, like, my dad is also a chemist, and just kind of understanding the phenols and the oil and how that breaks down. It's just not my thing. Like, I really know they'll probably fire me for saying this. If I had to choose,
Dr. Cowen, I think you might be typing.
Oh, I am. I'm sorry.
That's okay. That's okay.
If I have to choose between smoking and vaping, I'm gonna pick the smoking. Like, I would rather you do that than to vape. I'm just hands down. That's yeah. If I have to.
Yeah, I think we had some conversations too with when this first came out, all the vaping stuff last year with Dr. Pollack, who's one of our pulmonologists. And basically, we just don't know. I think that's a lot of it too, is we just don't know the effects. Like, there aren't head-to-head trials of vaping versus smoking to really compare, but probably not great either way, like Dr. Holmes said. So for my patient who asked about the muscle neck question, I can't figure out how to respond to you directly, but yes, the answer is you can make a visit with me and we can talk about it. And then for the other patient who wanted me to repeat Dr. Patricia Fry's name, I put it in the chat. So she's Patricia Fry. She's at Tacoma Park Integrative. Oh, I forgot to say earlier, they just opened another office in Chevy Chase. She goes there, and they do virtual visits. So that's another option as well. And a knowledgeable patient said, yes, the dispensaries are cash only. So, and then we have a bunch of questions in the chat here. Figure out what that is. Oh, is there a benefit for hypertension, for high blood pressure? Do you guys know?
So I tried to answer that. I don't know if I did it right. That was me typing. So I would never prescribe it for high blood pressure. I would not say that is a first-line medicine. I'm always going to give you a prescription medicine for high blood pressure. That being said, it's possible that it could lower a little bit. And because of certain metabolic pathways that medical cannabis can interact with, it has the potential to potentiate, meaning increase the effects of a blood pressure medicine. And I'm not necessarily saying that's a good thing, because it may be an inexact science unless you're doing it very consistently every day. But we do know that with like the ACE inhibitors and the angiotensin receptor blockers, that it may make those slightly more powerful, so to speak. So yes, but I'm not sure I would use it specifically for that. And certainly not to the exclusion of proper blood pressure medicines.
Have you used medical marijuana to help patients get off of benzodiazepines? So benzodiazepines for our patients who are not pharmacologists, those are like your Xanax and your clonopins and your lorazepams and your, all the sort of
Valium type medicines.
mixed with alcohol. So have you ever seen it? Do you guys know if it's used to taper people off of benzos?
Oh, you're on mute.
Sorry, yeah. I've never seen it used as a method to taper off benzodiazepines. That's not a use that I've seen it in. But Dr. Cowen, have you?
I have not done it myself. I have not been approached with that. I could see potentially maybe that it could be, but I have no experience with it thus far.
Okay. Do you know if medical cannabis has a benefit for someone with Parkinson's?
I've seen the videos. I have seen the video of the person with bad Parkinson's who then, I forget how they ingested it, but then, half an hour later is sitting there calmly. So I think there could be a potential benefit. I have not had any patients with Parkinson's in particular using it for that, but it's a possibility. I would certainly run it by your neurologist as well and make sure that they're okay with it. Because I'm not as familiar with it, but I could see it being possibly. Kharia, how about you?
Yes, I think it definitely has a role, especially in the muscle spasticity and things like that. But I wouldn't say that that's the end all be all and that you shouldn't be on your carbidopa levodopa. But I definitely would check with your neurologist just to make sure that there is no interaction. I think when I looked for drugs and interactions, I did not run across carbidopa levodopa having a significant interaction with cannabis, with medicinal cannabis. But yeah.
All right. So once prescribed, does one take it for a specific period of time, or is it a chronic prescription?
It can be something someone uses every day. It can be something to use as needed. There's no set in stone regimen by which you have to take it.
Okay. All right. Oh, there's an interesting chronic migraines question. All right, long question, so bear with me. I have chronic migraines and use Botox injections plus gabapentin, a muscle relaxer, and triptans when needed. I'd love to get rid of some of the meds, especially the triptans, since I can only use 10 a month. Some of the pain is also caused by bulging cervical discs. Would medical marijuana possibly help?
I would say potentially as a chronic pain syndrome. I don't think it's going to replace your Botox or anything like that, but perhaps could it reduce the number of times that you need to use a triptan, or at least have a need for another medicine. This is one of these things I would say, have you done physical therapy for your neck? Have you, addressed that part of it? So I will say yes, potentially, not to the exclusion of everything else that you're trying. And I'd have to check on the medicines, especially the triptans. Kharia, do you know if it interacts with the triptans?
I don't, but give me 1 second.
Okay.
Is there a database that you guys see interactions between medical marijuana and other drugs, or have you?
So sometimes honestly, I do use Dr. Google every once in a while. So I will Google it. Actually, drugs.com lists cannabis as one of its medicines, and you can look up 2 medicines with it. Or in general, it will list, all the major interactions, the minor interactions, the bulk of them being anything that's, potentially sedative. It may be potentiating that. But yeah, absolutely. I think if you look up something, you want to pick a reliable source. Mayo Clinic, drugs.com, NIH, the MMCC, the Maryland Medical Cannabis Commission, I think has a lot of information on it. I don't know if they get into the specifics of medicines, but it would be a great resource to start. Kharia, what are you looking it up under?
Drugs.com.
Yeah,
I was nodding. I'm like, yeah, that's what I use to look.
Yeah. Good.
So I think, so I put the other doctor's name in the chat in case any of you guys missed that. And then I think that's pretty much it. The other questions, there's a few in here that are very specific and personal to people's, current regimens or what they've tried. So if you're one of those, I would recommend, making an appointment with one of these 2 doctors to talk about what you've tried and what kind of strength you're on and what ratios you're on, because I think otherwise everyone else will be lost in the weeds.
Yeah, no interaction with the cannabis and the sumatriptans or the triptans. Yeah.
Cool. I would also hope that someone's dispensary would be a good source of information, not necessarily interaction with medicines, but if you're having a hard time finding a product that works for you, I would hope that you are able to talk to the person at the dispensary who is tending to you and get those questions answered. If you're going to a dispensary where you're not feeling that, I would absolutely have you shop around a little bit, try a different place, look for a different person. Because there's probably a dozen different dispensaries within a 15-minute radius of us. And I think there are probably some very knowledgeable people out there that can hopefully give you good direction because, I don't get the little details I don't know the little details of everything to say, go up on this, go down on this, other than the broad strokes.
Yeah. That's what I'm hoping to get my extra training on. So I will be able to do that.
All right. So they're going to come and see you with that. The prices also differ. So the prices also differ. You could go to, and the products differ. What one dispensary has is going to be different from what the next dispensary has, and what the prices are going to be different. So it's kind of like whether you choose to go to Target or Walmart or Costco. Same idea. You can go anywhere you want and look at the different products, and don't get something if you don't feel comfortable with it.
Yeah.
All right. I think that's the end of our questions. I think I've answered everything in the chat. People had some little side detail questions that I tried to get to. So thank you everyone for tuning in. Rick, thank you to Dr. Cowen and Dr. Holmes for giving such a wonderful talk. If you're curious, you can make an appointment with them. You guys are doing these as virtual visits right now too?
Correct. So normally they have to be in person, but all the requirements have been relaxed during the coronavirus quarantine. So we are now able to do them virtually. I don't know how long that's going to last, but right now they're virtual.
Yeah. So feel free to make an appointment if you're curious or if you have questions or if you want to try something. And then remember on Monday, Dr. Stephanie Park, who's one of our psychologists, is going to talk about stress and anger in the current COVID pandemic, but also with some of the racial issues that have been going on. So that should be an interesting talk on Monday. Wednesday, Dr. Mahmoud from Maryland Oncology Hematology is going to talk about anemia. And I specified to him that it needs to be at a patient level, not at a doctor level, so that it's something relevant to all of you. And then next Friday is 4th of July weekend, so the office is closed and we will not have a lecture. So stay tuned. Thank you to everyone who joined us today. It's always great to have you. Thank you to our wonderful speakers, Dr. Cowen and Dr. Holmes. And the three of us are full-time. So if you have any questions or want to make a visit, we are happy to help you. All right. Thanks, guys.
Bye. How do I leave this thing?
Just hit the X.
Thank you.
Talk to you later.
Bye. I'm trying to leave.